Okay. So this is Dr. Abbas Zainli from Saudi Arabia, originally from Pakistan. He is a doctor by profession, and we are going to correct his letter now. Yes. Dr. Lee Walter, surgeon, Stillwater Private Hospital, 54 Main Street. So this is an example for many other doctors who do not write properly, because his handwriting was not very excellent. It's not bad, but it was not very excellent. It was good, but now it is far better than, I can say 10 times it is improved. So I told him I will not correct it, please rewrite. So he has written this one again and presented, and it's really lot transformation, great transformation. I'll just show you the previous paper, and you can see the difference. I think not this. No, not this. Yeah. So this was the previous letter, and this is the present letter. So a lot of transformation. Very great, very good. Thank you for listening to me and transforming your style. Yeah. So here we are, 12 July 2021. Okay, one more suggestion for you, Mr. Zainli, is this. So when you are writing, you started from here. Why don't you go in a straight line like this? That is what it is. Instead, what you have done is you went inside, coming out, then again coming, then again out, then again in. So this is okay. Avoid this style of okay. Right, shaky margin. So what you can do is write in one straight line. So you can see the difference. So absent-mindedly, you are going like this. I know that it's not that you don't know. So straight line margin is important. So follow that straight margin. That would be better. And then, okay. So this is Dr. Abbas. Okay. And this is the link. Okay. Okay. So right. Okay. So Yes. So here is the letter. Right. And next. So here after RE, you should not leave this much space. Immediately you have to place the colon. Mrs. Carroll, this much, this is double space. This much space you should not leave. Single letter space. See like this. This is okay. See here. This is single letter space. Okay. That is what I am telling you. Use single letter space. You have used double letter space. See here. More than double letter space. So single letter space is needed. So that is how it is. You can see here. It is double letter space. So avoid double letter space, write single letters, leave single letter space here. Then regarding Mrs. Carol Potter, date of birth 30. So here you are supposed to write December, 30 December, that is better. So always write the month in words, wherever it is. Okay. December. Okay, 1947. Dear Dr. Walters. So this subject, this subject, take it up. This should go up. This subject, it should go up. So it should go here. Okay, here. It should go here in between. So here. So this line you have to write Dear Walters. Then afterwards you have to write regarding. So I'll show you an example. Right. Here is the example, the same letter which, okay, no, this is different letter. I'll give you an example. Yes, here it is. So, right. Dear Dr. Walters. Yeah, this is the same letter regarding Mrs. Carol Potter. Can you see there? Yeah, you can see there. It is very clear. So you have to follow these things. That is always better for you. So dear Dr. Waters, then regarding Mrs. Carol Potter, that is how you can write. Okay, fine. So what you have done is you have written this one's, this is first and this is second. Okay, so order up and down. Okay, so this should come down and that should go up. So they are reverse. So twist the lines up and down. So thank you for seeing Mrs. Potter. Comma should come immediately. Comma should come immediately, not so much gap. Comma should come immediately here. Immediately after or. Who is a known case of osteoarthritis since 2006. Okay. So when you are saying since 2006, then you have to say has been. Because since is for a long time. So almost 14 years. So you can say is a known case, who has been a known case. So for a long duration, is means now. If you want to say who is a known case, then don't say since 2006. So that is what it is. Okay. So you can use simple present tense without this since 2016. Now it is correct. Now it is correct. Who is a known case of osteoarthritis? That is correct. Otherwise, who has been, okay, right. So who has been or anyone you can use of these things. Okay, for the past 12 months, the severity has increased. She is complaining that the pain in her left knee has become very painful. Pain has become very painful. Pain increased. She is complaining regarding the increased pain in her left knee. Okay, like that you can write. And it is not relieved. Relieved spelling mistake. Relieved spelling mistake. So you can try learn dictionary and write it 10 times. Panadol Ostia. Okay. She is experiencing it even while rest. Okay, now here what you can write is you can write single sentence or you can write two sentences. Now, what is this type of letter? Let us see. This type of letter. Actually, what is this? What is it telling? Write a letter of referral. You have to write a referral letter. So you can use the word referral. Refer. I am referring. Okay, I am referring. So here you can write two sentences. How you can use, I'm going to tell you now. Okay, here. So you can write like this. Thank you for seeing, thank you for seeing Mrs. Potter, comma, okay. Thank you for seeing Mrs. Potter. Okay, right. Now, known case of force, what is the present complaint? Okay, left knee pain. So that is the present complaint. Okay, now let us see here. Worsening osteoarthritis. This is the complaint. This is the problem. This is the problem. This is the problem. So assessment, worsening osteoarthritis. This is the present complaint. Okay, now let us see here. Osteoarthritis has been there for long, but the present complaint. Okay, I'll show you. Better I'll give you this one. Home. Carol Potter. Yeah, here it is. Now let us see. So osteoarthritis 2018. Okay. This is one. Next, hypertension. This is two. Okay. Well controlled. Okay. Okay. So now also it is there, but controlled. Then skin cancer removed, insomnia 2 years. Oh, okay. Urinary tract infections. Okay. Right. For which is medications are these. Okay. Now let us go further. Treatment record. Okay. Recent test results. Evidence of severe osteoarthritis in left knee. The left knee. Osteophytes. Okay. Worsening osteoarthritis. So that is the problem. Okay. Worsening osteoarthritis. So you are writing to surgical consultation. So for surgical, this is your purpose of the letter. For a surgical consultation. Okay. So concentrate on this area and you are writing a referral letter. Remember that. The word referral, it is better to use. Okay. You can use either referral or discharge or transfer. So this is a referral letter. So use referral. If it is a discharge letter, use discharge. Okay. Right. Mostly they will be referral. If the word referral is not there, then it may be discharge letter or transfer letter. So remember that. Okay. Any one word should be there. Right. So assessment. Okay. Right. So fine. The next one. So you have to remember one thing here. Okay. This is 135. Okay, let us see. So there normally I'm showing you one example so that you can follow the same pattern. Don't write too much. So here you might have seen here, but this much you don't write in the letter. This long you don't write. Write one sentence or two sentences. One sentence or two sentences. So here, thank you for seeing Mrs. Potter is one. I am referring for so and so, like that one, second sentence. You can write. This is only 3 paragraphs, but actually you have to write 5 paragraphs. That is the problem with this particular letter. Okay. So always write one sentence or two sentences maximum. Don't write so long. So you can separate it into 2 parts now. Okay. So now, so she has well controlled hypertension. Okay. Urinary right. Thank you for seeing and considering her for a possible knee joint replacement. Okay, I'll give you another example which you have written earlier. So that is better. Okay. That is 80, 84 or something. Okay. Yes. Yeah, here it is. See here, so simple. So simple. Like this, you can write. This is better. You have already written this letter. So 1, 2, 3, 4, 5 paragraphs like this. 5 paragraphs. Thank you for seeing Mr. Brett Collister, a patient at this practice who present today with complaining of sore eyes and worsening vision. So I'm concerned that he has been experiencing symptoms consistent with type 2 diabetes. So like that, any 2 sentences you write, that will be fine for you. Okay. Right. I'm closing this now. So this is the way how you can present. Right. Thank you for seeing Mrs. Potter. Okay. Whose condition, who has okay. So worsening or osteoarthritis you can bring there. Okay. Worsening osteoarthritis you can bring there. And in addition to that one, you can say, I am referring her for a surgical consultation. Okay. I am referring her to you for a surgical consultation. Or you can directly write this. I am referring Mrs. Okay. Mrs. What's the name? Carol Potter. I'm referring Mrs. Carol Potter. Okay. Who is diagnosed with the worsening osteoarthritis. Okay. Or whose condition was assessed as worsening osteoarthritis. Okay. For a surgical consultation. So these things you try to write in. There are many different ways you can write. Any way you can write, but these 3 things you write. First, 4 different things you write. Okay. What are those 4 different things you are supposed to write? Okay. What are the 4 different things you are supposed to write? Number 1. So first one is the patient's name. The patient's name. The patient's name. Number 1, the patient's name. And type of letter. Is this a referral letter or what? Type of the letter. Type of letter. The type of letter. The type of letter. Okay. Number 1 is the patient's name. Number 2 is the type of letter. And number 3 is the present condition or a diagnosis or signs and symptoms or whatever it is. The present condition or diagnosis or operation, underwent surgery or admitted in the hospital, or presented with signs and symptoms, or signs and symptoms whose signs and symptoms are suggestive of something. So like that you can write the present condition. Okay, next number 4 is the purpose, the future purpose. The future purpose. Why you are sending him there? The first one is for the present, and this is for the future, post-discharge. The first one, third one is pre-discharge, and the fourth one is post-discharge. Okay. Dr. Abbas. Dr. Abbas, just unmute for a second. Is that clear to you?
Yes, yes.
Okay, no need to write too much lengthy points in the introduction itself. Be sweet and simple. Okay. Okay.
So in
right.
the introduction, only these 4 points, huh?
Yes, these 4 points are enough.
Okay.
Don't stuff it too much. Don't stuff it too much. If the head is big, no, it will be odd. Okay.
Okay.
So let the body be bigger and head be smaller. Okay, fine. Now these are the 4 things you can use. The patient's name, the type of letter, the present condition. Okay. Right. So I am referring Mrs. Carol Potter. Okay. Comma. Who was diagnosed with worsening osteoarthritis, comma. Okay. I am referring already, we told that is type of letter, the present condition. Okay. Then future purpose, for a surgical consultation, for your expert assessment and a surgical consultation if required. Okay, so like that one, whatever it is, you change this one. However, don't use the same words as far as possible. Right. Next one. Right. Next. Right. Here it is. Yeah. Thank you for saying. Okay. The severity has increased. She is complaining that the pain in her left knee has become very painful. She, okay. For the past 12 months, the severity has increased. Okay, fine. For the past 12 months, the severity has increased. Not for the past 12 months, during the past 12 months. Okay, there was a gradual increase in the severity of pain. Okay, pain severity increased gradually. Okay, like that you can say. Increased pain in her left knee was reported. Okay, increased pain, very painful means increased pain. Okay, was reported. Okay. Then next one, try to use passive voice as far as possible. She is complaining is present tense. She is complaining means now. Okay, right. Has become very painful and it is not relieved. Relieved spelling mistake. Okay. Treatment. Okay, Panadol Ostia could not relieve. Okay, which was not relieved. The pain which was not relieved. So severe pain, okay, increased pain, okay, was reported, which was reported, okay, you can use like that one. So relieved spelling you have to check, and with Panadol Ostia, you can write passive voice as far as possible because you are writing active voice. How to write passive voice and how to write active voice. Okay, so could not be relieved. The pain could not be relieved by, okay, osteo. She's experiencing it even while rest. She is experiencing it even while rest. Okay. So change it, transform it. It's very simple and it's very ordinary. Then next one you can say on examination, comma. Always whenever there is a phrase in the beginning, there is no swelling or redness on her knee joint. On examination, okay, there is no swelling or redness on her knee joint, but decreased range of motion is noted. Okay, so first one is you are saying active voice. Second one you are saying passive voice. Okay, second one is good, but first one is not fine. So change it also into, okay, on examination, swelling or redness on her knee joint, okay, were not, okay, present, were not noticed, okay, were not found, okay, but decreased range of motion is noted. Okay, so on examination, so when you did the examination, it is past, it's not present. It's at least 1 hour before you examined, not now. This is writing the letter. On examination, that time, particular time, it's done, it's finished action. So you can write better in past tense, past tense. And that too in passive voice, you write better. So decreased range of motion is noticed. Okay. Examination revealed decreased range of motion. Okay. Decreased range of motion was observed on examination. Decreased range of motion was observed. Better word, noted instead of noted. Observed is even better. So her right knee is in much less pain comparatively, you can say compared to, comparatively, her, the left knee. No need to write every time her, she. Avoid her. Too many times you are using her. Okay. Avoid that one. Better you say the right knee was the right knee had comparatively less pain. Okay. So then the other, that is the meaning. Okay. Initial conclusion after X-ray. Initial conclusion after X-ray was that her left knee has developed. Okay. You can say X-ray revealed something. Based on that one, you diagnose this one, or you concluded that, something like that you can say. Okay. Severe osteoarthritis. X-ray confirmed the diagnosis, or something like that. Maybe X-ray confirmed the diagnosis. You preliminary diagnosis is confirmed because of this one, or you have a preliminary diagnosis. Maybe you thought this is that one, and now you can see that one. Severe, or okay, that was confirmed. You just had doubt in the beginning, but it was confirmed based on this. Maybe okay. It was decided to increase her analgesics to naproxen 250 mg twice daily. So, increased dosage of analgesics, okay, naproxen, okay, 250 mg twice daily was recommended. So you can write increased dosage was recommended, or an increase, okay, naproxen 250 mg twice daily along with physiotherapy. Okay. So in addition to, you can say, along with physiotherapy, or in addition to physiotherapy. It was in her best interest, spelling mistake, INTEREST, interest, to take surgical opinion for left knee replacement. So it was her best interest, okay, to take a surgical opinion for the left, okay, for left knee replacement. Okay. So a surgical opinion for replacement of the left knee. Therefore, you are requested to provide expert advice and management after thorough, not through, thorough assessment. So it was decided. Unnecessarily you are using pronouns. So okay. So increasing the dose was recommended. Okay. Increased dose from dash to dash, from 150 mg or 250 mg or once daily to twice daily, something like that was recommended, from so and so to this one. Okay. Was recommended. It was in her best interest to take a surgical opinion for left knee replacement. Okay. You can say a surgical opinion was requested. A surgical opinion was requested, or something like that. Change it into passive voice as far as possible. Okay. Therefore, you are requested to provide expert advice based on the above circumstances, based on the above conditions, based on the above mentioned circumstances. Your expert advice, ADVISE, no, ADVICE, noun means CE. You, okay, CE, not SE, it is CE. Expert advice and management after thorough assessment. Thorough spelling, THOROUGH, thorough assessment. Okay. Mrs. Potter's past history is significant. Mrs. Potter's past history is significant as she was diagnosed with hypertension in 2005. It is well controlled with Ramipril, 5 mg once daily. In 2016, her skin cancer was treated by surgical removal. Don't cut the word like this, because if you cut the word, you have to break it into 2 parts, and 3 letters you cannot write. At least 4 letters you have to write. Better not cut the words like this. Write in the next line, or adjust in the same line. Don't write in this side area and here itself. Okay. If this is not fitting here, you can bring it here, or if you can fit here, you write here itself. Okay. You can adjust here itself. Since 2016, She is having intermittent insomnia and urinary tract infection. You cannot break this word, 5-letter word. If you want to break the word, you should have at least 8 letters in the word. If there aren't 8 letters, you cannot break the word. Second thing, when you break also, that side at least 4, this side at least 4. And you cannot break a syllable, you cannot break between 2 syllables. These are the 3 rules you have to follow. Okay, fine. Infection for her insomnia. She is prescribed 10 mg tomazepam. So you can say 10 mg tomazepam is prescribed. Okay, it is not is prescribed, it is was prescribed because it is okay, for which she is taking, for which she is on. Okay, you can say like that because it is long time since 2016 she is having. No, when you say since 2000, she has had. Okay, so you can say like that one. She has had. Okay, present perfect you can use, or present perfect continuous you can use with since and for the last. So if it is a very long duration, you can use present perfect or present perfect continuous. That means now also she is facing the problem. Okay, that's what it. For her insomnia, urinary tract, for her insomnia, comma, here you have to put a comma. Okay, here you have to put a comma. She is prescribed 10 mg, okay, at night as needed. Instead of needed, you can say required. Also, comma, of note is her family history. Of note. This doesn't sound very fine. Of note or something like that. So avoid that one. Okay. Her mother had breast cancer. Okay. So she has a family history, you can say. You can write as a family history of, okay, breast cancer on the maternal side. Something like that. Then your consultation for Mrs. Potter will be highly beneficial. Okay, no need for her because it is for her only, not for somebody else. So your consultation for Mrs. Potter will be highly beneficial. Okay, should you feel the above information, should you feel the above information is not sufficient or any clarification is needed, please do not hesitate to contact me. This sentence will not get any mark from here. This last sentence will not give you any mark. So don't overemphasize on this one. Just say in case or if you require, or if any additional information is required, please do not hesitate to contact me. Like that you can write. So that would be better for you. So right. Okay. Regards. Dr. Abbas Zainli. So name is there. So you don't write your name because the name is not given there. Just leave it. If they give some name, then you write. If they don't give any name, don't write. Okay. So avoid this one because they did not give any name for you. So don't write. So leave 2 lines. Stillwater private practice. Okay, fine. Okay. So you're a doctor at Stillwater private practice. Okay, doctor, Stillwater private practice. That's all. You can write like that. That's enough. No more. Okay. Stillwater private practice, Stillwater. So Stillwater private practice, Stillwater. That's all. You can write like that because it is in Stillwater only. Name of the practice. Okay. Yes, Dr. Abbas. Hello.
Yes.
Yes. Have you noticed the differences? What you have to do?
Yeah.
What I want you to do is don't write another letter. Improve this letter and give me again. Okay.
Okay. Same letter.
Yeah, same letter. What all suggestions I have given. Try to improve round 1. Okay. Let us first learn the first letter properly. Then we'll go to the next letter. Okay.
All right.
Okay. So try to improve as far as possible, whatever I have given, try to implement, and then I'll give you more suggestions. Okay, right?
Okay.
Okay, fine. So try to avoid it. Okay, you are writing too much of it. Okay, passive voice you are using, but it was in her best interest to take a surgical opinion. So you get straight, you are just beating around the bush. Okay, surgical opinion was sought for, finished. Okay, surgical opinion was requested, finished. Was requested, a surgical opinion was requested, straight, simple. Is that clear?
Okay.
Okay, fine. So who is the next one? Okay, fine. So you write again neatly. Okay, then I'll give you another round of correction, second round. Okay, in the which format I'll give you means, so if possible, first you write it neatly. Still, I want you to practice more writing. Then next one afterwards, I'll give you this type of correction. Okay. Yes, it is here. You can see. Okay. Okay, this. So like this, you'll get a correction. Okay.
Okay.
It will be typed, and afterwards you'll get this correction. Okay.
All right.
So I will, when it is typed, I can automatically insert new words, improve the quality, and I can give you more things. Okay. First of all, your mistakes, lot of mistakes are there. Spelling mistakes, grammar mistakes, active voice, beating around the bush, too much of explain, using personal pronouns, avoid repeating the word. Pain is increased pain. Okay, like that one. Repeated, duplicated words, ordinary words, all these things you remove. Think about it. Take half an hour more, no problem. 45 minutes you take more. Try to improve as much, because you are a doctor, you can definitely, and you are really very obedient to your calling. Of course, I don't want any obedience from anybody. Be obedient to your calling. That means you want to get excellent result. Actually, in the first test itself, you got B grade in reading and listening. Means here also you can get excellent result. So try to work hard. Try to think about that one. Take half an hour or 45 minutes, even 1 hour, no problem. Work on this. I don't want to do anything today. Don't do reading, don't do listening, don't do speaking, anything today. Only concentrate on these things and show me. Today you should not sleep. You should not go to bed without getting this perfected. Okay?
Okay.
I'm telling you, no, I will be there with you until you submit this one and get it corrected.
All right.
Do whatever you want.
This correction that you told me, you will leave its link on the WhatsApp, right?
Yeah, which correction?
The one you were telling me right now.
Right now, which I was giving you, right?
Yeah.
Okay. No, I will not post it now in the group or Telegram. I'll just send it to you. Okay.
Please. Yes.
Okay. Fine. So now let us see there. I'll send it to you directly now.
Yeah.
Okay. File, save as Abbas Zainli. Okay, this is feedback. Okay, what is the name? Porter feedback. Feedback. Porter feedback. This I will send it to you.
Please.
Personally, because okay, I'll send it to you. Where is that? Yeah, here I told. Yes, this is Mr. Zainli. Abbas. Here it is. So I am sending you here. Yeah, I'm sending it personally because I want to see improvement before posting. Okay.
All right.
Then I will post. Right.
Yes.
Okay. Fine. Fine. So that is this. Then next one is who is there? Who is the next in order? Prabjit, I have corrected the letter. Then next, who is the next in order? in WhatsApp. Yes, here it is. Yeah, ANSI. So Preeti is over, Rashid is over, Prabjit is over, ANSI. Hello, ANSI. ANSI is there? ANSI is not there. Okay. Next one is Sangeeta is there? Sangeeta is there. Hello, Sangeeta.
Hi, sir. Good evening, sir.
Yeah, good evening. Good evening. After my dinner, I will give you correction. Okay.
Okay, sir. Thank you, sir.
Okay, one by one, I am correcting. Today night, if anybody is not there also, I will correct their papers and I'll post them. Okay.
Okay, sir. Thank you.
Okay, fine. Next is your letter.
Thank you.
Okay, dear. So one by one, whoever names are there here, whoever asked me for submission, I will give the correction. Okay, then see you.